Hi. So for musculoskeletal ultrasounds, I learned that it's low cost, it's it's good for real time studies and interventions because the results are fast. It has better resolution than an MRI, and it also has more hertz, and that means like it gets deeper into the tissue, and you can see the tendons and the ligaments better in the tissue. Okay, now for the shoulder evaluation. First, I would ask past history questions and present history questions, OPQRST and sample. OPQRST, O stands for onset, so like the event and what happened to occur, like for the injury to occur. Q or P, like provoking factors, so what makes it feel bad, what makes it feel good. Um, Q, quality of the pain, so is it dull, sharp? R, if the radiation, so like the patient would show wear with one finger first, and then he ask if it spreads anywhere else or it's just in that one spot. S for severity, so on a scale of 1 to 10, what's the pain? T for time, what time did the event occur, where the injury occurred, how long ago. Then you could also ask sample. S stands for signs and symptoms, so like what's wrong with them basically, why are they here. A, allergies, are you allergic to any medications, food, stuff like that. M, medications, are you taking any medications like Advil, or you have on any prescribed any medications. P, past history, past injury history in that area or just overall. L, last oral intake, what's the last thing they ate, when did they eat it. E, events leading up to the event of the injury, what were they doing. Okay, then with the shoulder evaluation for inspection, first you would inspect for swelling, deformity, um, posture, and discoloration. So, and then you would check if the shoulders are equal. Check if the shoulders are equal. Shoulders are equal with the arms hanging. So you go ahead and stand up. Arms hanging. The shoulders equal. Looks like this shoulder's a little bit above the rest. The other shoulder. So left shoulder's a little higher. Go ahead and sit down. Check for atrophy and hypertrophy. And then if the scapulae is winging. So the scapula is winging. Now for the bony palpations. Come over to the front. Record this. The clavicle right here, the sternoclavicular joint, which is right here, connects the sternum and clavicle together, and then the acromioclavicular joint, which connects the acromion and the clavicle, and then we check for the humerus head, which is right here, the humerus, and then the bicipital groove, which is right here. Then we look at the scapula, so right here, we're checking for the acromion process, which is right here, the coracoid process over here, then the inferior angle, which is here on the scapula, the medial angle here, the medial border, the lateral border, the spine of the scapula, which is right here, and the supraspinatus fossa, which is here. And then we would take a look at the soft tissue, the rotator cuff muscles. We already identified the supraspinatus. Stay close. The infraspinatus, which is just below it. The teres minor, which is here, below the infraspinatus. The subscapularis, which we can't really palpate because it's deep. And then we can go for the deltoid, which we can go right here, deltoid anterior, deltoid middle, and deltoid posterior. Then we would check for the trapezius, or the pectoralis major, which go ahead, come to the front, which is right here. And then the pectoralis minor, just below the pectoralis major, just a little bit below. Then the trapezius, so go ahead and turn a little bit, come right here. The trapezius upper, trapezius middle, and the trapezius lower. Then we have the rhomboids major, right here, the rhomboids minor, which is right here. Then we have the latissimus dorsi, which is like this wing thing that covers from up here near your trapezius all the way down to your buttocks. Then we have the biceps right here, and the coracobrachialis right here. Then we have the levator scapulae right here, which goes right here. And go ahead and shrug. That's what allows you to get shoulder elevation. Then we have the serratus anterior, which is down here, and it's these finger type things, finger type muscles. Okay, now we're going to check for range of motion, and we're going to do active range of motion. So go ahead and do flexion from start right here and go straight up. Flexion to 180, then extension to 60. Cool. Now we're going to do horizontal abduction. So go ahead and do this. Nice, nice. And then adduction to 45. Cool. Now we're going to do horizontal abduction. So away. And then across your body, adduction. Horizontal adduction. Nice. Now we're going to do scapular elevation. So scapular depression, scapular protraction, scapular retraction. Cool, nice. And then now we'll do internal and external rotation, also known as medial and lateral rotation. So start right here. This is internal or medial rotation, and then external or lateral rotation. And that's performed at a 90-degree angle. Hey, now we're going to do some resisted range of motion, RROM. Go ahead and let's do flexion. So start like that. Go ahead, flexion. Nice. And that's working the pectoralis major, the anterior deltoid, and the biceps. And then now we're going to do extension. Go ahead. Nice. And that is the latissimus dorsi and the teres major. Okay. And now we're going to do abduction. So away from the body like that with resisted range of motion. Go ahead. And that is the middle deltoid and the supraspinatus. Okay. And now we're going to do adduction, adduction. Nice. And that is the pectoralis major and the latissimus dorsi again. All right. And now we're going to do internal rotation or medial rotation. So go ahead. Okay. And that is working your infraspinatus, or your pectoralis major, your teres minor, or your teres major, your subscapularis, which we can't palpate, and your latissimus dorsi again. Now we're going to do external rotation. Externally. Nice. That works the infraspinatus below the supraspinatus and the teres minor. Now we're going to do horizontal abduction. So go ahead and straighten your arm and go ahead. Here, we can do adduction first. Go ahead. Horizontal abduction. Nice. That's the anterior deltoid right here. The pectoralis major. Go ahead and relax your arm. Pectoralis major and the coracobrachialis. That's the only one the coracobrachialis is involved with. A lot of these other movements involve all the other muscles. Coracobrachialis seems like it only has one purpose. Then we're going to do horizontal abduction, abduction. So go ahead, away, nice. And that is your posterior deltoid and your latissimus dorsi. Now for this one, for the scapula movements, we're not going to do any resisted range of motion because it's hard to do. So you're going to do scapular abduction or upward rotation, so like this, like that. Then we have scapular elevation, which does your trapezius and your levator scapulae. Oh, let's go over it. Scapulus adduction, which is an upward rotation, is when you have your serratus anterior working. Okay, and then your scapular adduction, when you pinch your shoulder blades together, pinch them together, just go straight back and pinch them together. That is working your trapezius, or your middle trapezius and your rhomboid major. Then we have scapular depression and abduction, or an adduction, so scapular down and pinch, and that is working your lower trapezius. Then we have scapular abduction and downward rotation, so like this, pinch, downward rotation forward. That's your rhomboid major and your rhomboid minor. Okay, and then we do the neurological, but we've already done that on the worksheet. We do motor, so deltoid, the C5, working the deltoid, wrist extensor, C6, and then we do for C7, there's three things. Tricep, so go ahead and extend your arm. Wrist flexor, so towards your, you can just do towards you, nice, and then do finger extensions, so fingers extending, nice. Then finger flexors for C8, so towards, nice, and then finger adduction and finger abduction for T1, moving them away from each other and closer. Then we would do sensory, and for sensory, we go ahead and come over here. C5 right here, and we do this for both sides, and we ask if it feels the same, or what does it feel like, sharp, pain, or dull. So C5 is here, C6 right here, C7, C8, and then T1. And then you would do that on both sides. And then now we're going to do the reflex test. So for C5, you have them relax, and then you would hit here with the reflex hammer. For C6, like this, hit here with the reflex hammer. And then for C7, your triceps tendon, relax, right here with the reflex hammer. And then we would do the blood flow test. So go ahead, and we would do right here for your radial pulse, and we want the rate, strength, and rhythm. So I'm going to do this for 15 seconds. Okay, and I got 19. So that multiplied by 4 would be 76. So that'd be 76 strong regular. Okay, and then we would do the recapillarization, and that's just squeezing. Come over here and see this. We squeeze the finger. See how it turns white and goes red? It should go red within 2 seconds. Check both sides. And then we would do the other hand. Okay, and then we would compare bilaterally.